Pandemics by
Colin Sinclair.
Adam Schmidt.
Benedict Macy.
Nice Pearson. What is a pandemic? According to Oxford Dictionary, a pandemic is a widespread occurrence of an infectious disease. History of pandemics 1. Black Death. According to Britannica, the Black Death killed over 200 million people around the world. This pandemic occurred from 1347 to 1351. The disease was spread through bacteria caused by rodents infected with fleas. This disease had a high mortality rate due to little medical knowledge known. The disease originated in China, however reached Europe via generalized ships. The pandemic spread through Asia, Europe, and North Africa. Spanish flu. According to Ruth Leinfeld, a medical director and state epidemiologist in Minnesota, the Spanish flu caused over 50 million deaths in 1918 and 1919. Due to the pandemic breaking out right after World War I, most medical staff were stationed overseas, leaving the hospitals being overwhelmed with patients and no staff to help. Scientists speculate avian origin, however, the species is not known. COVID-19. Adam D. Brown, an associate professor at the NYU Grossman School of Medicine, states that COVID-19 originated in Wuhan, China in 2019. COVID-19 was able to cause the damage that it did due to the lack of readiness, overwhelming healthcare programs. According to Worldometer, COVID-19 has claimed over 6.9 million lives. The main problem that all these pandemics have faced is a lack of readiness in healthcare and fewer resources available into hospitals.
Our first solution for this problem is to put guidelines in place for forced isolation and quarantine. Evidence. The first piece of evidence supporting the solution comes from Chinese researchers from the Shan Jiaotong University. Their study found that, quote, with travel restrictions, the amount of infected individuals in 7 days will decrease by 91% in Beijing compared with the scenario of no travel restriction. The second piece of evidence is that quarantine, isolation, and border control lower infection rates. This evidence comes from a study done at the Laval University in Canada. This study showed that public health measures like isolation, quarantine, and border control can effectively control infectious diseases and maintain society structure during pandemics. The third piece of evidence supporting the solution comes from a study done by St. Mary's Hospital in London. This study showed how better public disinfection services decrease contamination. And it also showed this graph, which shows how a virus can spread from an infected individual to a susceptible individual in its many different ways. Implications. This solution would provide more reliable guidance from health officials and set guidelines in place that would better prepare us in case of future pandemics. This would better incline the public to trust and comply with the limitations that may be caused by this plan, and reduce the overall infection rate of the disease. By making laws that could force isolation, there would be no human contact, which would mean the virus would have no possibility of spreading. Because there are less people being sick, there would be less stress put on hospitals and the healthcare workers that work there, allowing them to more focus on finding cures and treatments for the disease instead of merely keeping people alive. Limitations. Forcing people inside would slow and hurt the economy, as it would allow less people to spend their time and money in public places, such as restaurants or stores. Forcing people into social isolation has been proven to worsen or even cause mental illnesses, which could cause long-term problems. The final limitation is that many will resist this intervention. As we've seen in the previous COVID-19 pandemic, people rebelled or did not follow the guidelines set by public health officials, as they viewed it as restrictions of their freedoms. However, if we implement these laws carefully with checks and balances, the public will eventually come to accept this.
The next solution is to invest in public funds to research aspects for possible future global outbreaks. Some evidence of this is shown through Simone Pequeña's article, where she explains that through delivering safe and effective COVID-19 vaccinations will lessen the amount of harm it has on the economy and the healthcare system. This next piece of evidence explains that the occurring conflict, violence, and natural disasters play a key role in Maynard's health sector, which aligns with the states of Rakhine, Kachin, and Northern Jahan. Both of these pieces of evidence aligns with the innovation measures for treatment, contemporary biomedical advancements, and personal protective equipment for medical workers, which is shown in this image. The implication of this solution is shown. The implications of this solution would be a global safety net, which would be established, which leads to less panic, as we have prior knowledge from past pandemics, such as COVID-19. There will be a wide application of the treatments, which nations provide safe and effective vaccinations early on to lessen the amount of deaths to occur. And more time would be spent on research, which would eliminate possible threats to occur and build more innovative.
Finally, solution two's limitations would be that taxation would likely have to be raised. So this is due to the fact that with research and the PPE that needs to be provided for medical workers is very expensive, and the government will need to fund this through likely a higher taxation. And some of these measures may be too preemptive. Threats may also evolve faster than observable. So this would mean that, as we saw in the COVID-19 pandemic, the virus had mutated multiple times, and with the spread increasing, the mutations are unpredictable, and this could be seen as heeding to research and just providing funds for protective equipment. And there's also a heavy reliance on the public. So if the public doesn't agree to fund such projects, then the COVID hospitals will be overwhelmed. Finally, which solution is better? So we chose solution one as our better option because of its feasibility, which means that with information from public officials, many will just side with the option that doesn't require such cash payments and increased taxes, and they will most likely side with this. And also economic costs. There will have to be certain spending and funding only certain industries such as PPE and other research. And finally, efficacy. There's no chance that the virus can spread a significant amount if people decide to quarantine effectively and isolate from others for a certain amount of time. Here's our bibliography.
7 minutes 43. So in the problem part, I don't know who did the problem part.
I did.
You did the problem at the beginning? Setting up the problem.
He did.
Okay. Did you say what? Tell me what you said again. Could the next group go? Are you
I said that the main problem with all of these